channel. My name is Ongwe Mwangi and this is Nursing with Koi. I'm a Kenyan RN and I do videos on nurse education, patient teaching as well as health education. And today I come back with episode 4 of the midwifery series, and today we'll be discussing warning signs or danger signs during pregnancy and exactly what to do if you see some of these signs. So if you hear danger or warning signs, it should tell you that you need to be in a hospital or with a healthcare provider or with your doula or midwife or your gynecologist as soon as possible, because there is danger. So if you're new here, please take your time to subscribe and hit the bell icon so that you're notified every time I upload an informative video such as this one. And if you're a returning subscriber, know that I deeply appreciate you. So let's dive right in. So number one of the warning signs or danger signs during pregnancy is any vaginal bleeding. During pregnancy is a period where you are exempted from having your monthly periods, and therefore you should not be experiencing any bleeding of any sorts. So the moment you see bleeding of any kind, then it is time to contact your medical provider or your healthcare provider or your midwife so that they are able to help you as soon as possible, because that is not a good sign. It is a sign that something should be done and fast to save you and your baby. So number 2 on this list, I would list severe headaches second. It is not normal to have headaches throughout your pregnancy, or there are people who say, I always have headaches. It is important to get yourself checked if especially you're experiencing severe frontal headache, because that could be a sign of something else being amiss in the body, and that's a symptoms of something underlying that needs to be sorted out as fast as possible by your obstetrician, your nurse midwife, your doula, the person who provides your healthcare for you. If you do not have a specific person, then you go to your nearest hospital of choice. And if you do not have that option, then again to the nearest health center, to the nearest dispensary, to the nearest district hospital or sub-county hospitals or county hospitals or referral hospitals. But you need to be seen by somebody qualified. Symptom number 3 is having severe abdominal pain. Pregnant or not, this is usually a medical or surgical emergency. So in the event that you have severe abdominal cramping and pain in your pregnancy, it should tell you either it is the onset of labor, because my labor has either come early or it's time for delivery. It could also be pain because of other things in your abdominal area, and therefore you need to go to the nearest hospital, to your healthcare provider for further assessments and help. So number 4 on that list is fever. Having a temperature beyond 37.5, that is a temperature beyond the normal range, or a temperature below 35.5. So if you're experiencing these ranges of temperatures, it's a good sign for you to go to the hospital, get checked out, just to make sure you are better safe than sorry. So it is important to go to the hospital, to go to your obstetrician, your midwife or your doula, so that they're able to refer you or help you at the point of need. Number 5 on the list is having convulsions or fits. You know the way we describe those convulsions, kuvireka, those, having fits, the one like someone who has epilepsy gets. That's a danger sign in pregnancy, and it means you should be checked out by your healthcare provider as soon as possible. And it is very important to have your blood pressure taken at that point, because they also need to rule out if this has been caused by your blood pressure rising. But most importantly, get checked out. Number 6 in this category, we have reduced or no fetal movement. Usually from the 16th week onwards, you will be able to feel your baby kicking, what we call fetal kicks, or moving. Those movements, you get to adapt to them. You're able to tell that this child is playing this much. Sometimes they rest, sometimes they are playing. But if your baby is not, or whoever is inside you is not playing as hard as they usually play, or there is no play at all, or the kicks are absent, it is immediate. There is immediate need for you to seek healthcare advice and medical checkup for assessment and treatment if need be. Number 7 on this list, if you start suddenly having blurred vision, or you're seeing things in 2s or 3s, your vision is not as usual, and you're having frontal headache, again, go seek health advice immediately for assessment, just to rule out any complications that could happen or occur during pregnancy or childbirth. So another danger sign or warning sign in pregnancy is nausea and vomiting excessively. Underline the word excessively, because if you're not retaining anything and everything that you eat is coming out, then it is a high time for you to actually get admitted so that your nutrition status can be taken care of for your sake and for that of your child. So it is important to ensure that you're taking balanced diet and enough food with enough nutritional value to suffice for both your needs and those of your baby. So if this is not possible because of the excessive nausea and excessive vomiting, this could leave you dehydrated and put you at risk, or put your life at risk and that of your child. So again, seek medical advice. So another danger sign or warning sign in pregnancy, this is number 9, is leakage of fluids or the amniotic fluid. What we say, the water has just broken, or my water has just broken. Whether it's at term or before term, again, it is important for you to be assessed, because anytime that water comes out or the fluid leaks, it needs to be assessed. The baby needs to be assessed, and we know that sometimes the cord could be around the neck where it's not supposed to be, so that the healthcare provider can assist you and save your baby's life, because at that point it is quite risky. Sometimes it is actually very seamless, and that happens almost seamlessly, and you're probably approaching delivery, and that's why the water has broken. But most importantly, once you see the water leaking, it is important for you to get assessed. Number 10 is foul smelling vaginal discharge. This could be an indicator of infections. Most importantly, it is important to get assessed early, so that if it's a sexually transmitted infection, then it is treated, or whatever kind of infection it is, but then there shouldn't be any foul smelling discharge around there. But pregnancy kind of makes someone more vulnerable, and therefore if you experience this, and especially with yeast and those foul smelling discharges, then again, seek medical advice, so as to ensure that mother and baby remain healthy till term. So another warning sign in pregnancy, I don't remember what number we are at, I think it was number 12, is having difficulty in breathing. Difficulty in breathing mildly could happen because of the increasing baby weight, and it could be related to the positioning or the position you assume. So if you're changing positions and that is not being elevated or is not being alleviated, then again it is important to seek health advice or assessed, so that nothing is left to chance and you remain safe. Another warning sign that could actually land you to a hospital is burning sensation as you micturate or you urinate. If while passing urine you're feeling pain and that burning sensation, some people say they feel like they are urinating pieces of glass, it is a high time you see your healthcare provider, so that they can do a fast assessment, so that they rule out any of those infections that could actually cross that placental barrier and go over to the baby's side and cause a lot of harm to the baby. So in case you have any of these symptoms, and I think I will add the very last one next. So the last but not least is dizziness and fainting. If you have syncope episode more than once, sometimes this could happen earlier on, or when you overexert yourself, or when you overwork. But then that should not be the norm, or having episodes of where you're fainting and feeling dizzy all the time, that needs to be checked out. It could be an indicator of probably anemia or low HB or blood counts. But then because we do not want to guess and you don't want to leave the baby to chance, then it is important for you to actually get checked out. So thank you so much for watching through this video. It is because of you I do these videos. I want to change the format of my videos to talking head. Talking head is what I am doing now, as opposed to the projected PowerPoint presentations with head, because these ones are quite fast, and I think now I have the gadget for the talking head videos. I had lost some of my instruments or equipment for this, and that's why I have been doing the PowerPoint ones. These ones are quite easy to follow, and again, I'm able to give my honest input on each and every one. However, for points of reference, the other ones are better because there is a written down slide either below or above my talking head. But then if you want me to go back to the PowerPoint ones, you can also tell me. But from episode 4 through to episode 10, I will do this format of talking head. So thank you so much, and bye.